Today we're going to talk about an exercise that we use at the baseball mentorship at Cressy Performance. It's called the 90-90 ER hold. We do it in a half kneeling position. The goal of the exercise is to try to work on rotator cuff activation, rotator cuff strength, but in addition to that, there's a lot of faulty movements that we can correct, such as scapular depression, anterior glide of the humeral head, lumbar extension, a lot of different pieces of the puzzle that we work on in a lot of our other training exercises. So this works as a good activation piece to try to turn on certain muscles, to try to get certain muscles to turn off, so that it leads into some of our bigger training sessions, into our throwing programs and things like that. So I'm going to bring Kyle in. We're going to get down into the half kneeling position, which seems to be the best position to work out of. And I'm going to go through a few faults and a few benefits of this particular exercise. So what we do as a starting point is we get them to understand what position they want to start in. So some of the normal tendencies are to start in kind of an arched position of the lower back. So if you can kind of arch into that position, where guys tend to kind of pull into external rotation by working into lumbar extension, which is a common compensation that we see in throwers, but we also see it when we train. So we ask them to kind of put their hand on their ribs and kind of tuck their ribs down a little bit to engage your anterior core to prevent that from happening. Another thing that we see when guys start to push into external rotation is that they'll pull back into horizontal abduction, overusing their posterior delt and playing the role of their rotator cuff, which is another faulty pattern that we want to try to avoid. The last big one that we see is that guys tend to push down into more of an elbow down position, which engages the lat, gives us some false stability, pulls us into a little bit of lumbar extension, scapular depression. So those are all patterns that we want to look at before we even start. We coach that up in some of our other exercises, but this one kind of works to blend it all together so that they can work their core and integrate that with their scapula and their rotator cuff at the same time. Okay. As we start, we look at their head position, make sure they don't have a forward head posture, their ears are in line more with their shoulders. So a lot for the athlete to think about, and from our end, once we get all of those pieces in place, we want to monitor that as things get more difficult. So one of the pieces that we want to look at when we start is that we give them a sense to be able to relax their arms so that they're not holding it up here, but at the same time they're not driving down through their elbow when they go through the motion. So you cue them to keep their palm open and keep their palm square, and then they're going to push back into an externally rotated position, trying to activate their posterior cuff and not overusing, again, their lats or lumbar extensors, their cervical muscles, and etc. So what we're going to do is we're going to go through the motion. We tend to start early on with a position where we're in a little bit of actual internal rotation, and we ask them to push back lightly into external rotation so that they can find their cuff, make sure they're using the right muscle group as they go along. So we'll have them hold it for an extended period of time so that they can feel that. Then we'll bring them back a little bit further, and we'll ask them to hold. So we usually do about a 2 or 3 second hold. We'll do about 8 reps or so, and we'll gradually bring them deeper back into external rotation so that they can feel their rotator cuff kicking in. The deeper we get them, the more likely they are to come into some of their compensations. So we want to monitor that. So we go as deep as they possibly can go without making sure that they're popping the front of their shoulder forward or without coming into some of these other compensation patterns that we want to look out for. So early on, first couple times guys are doing this, right at the end of a long season, you're not going to lay them back into full external rotation, potentially irritate their bicep tendon or their labrum. You might start them more in a 90-90 position. As they get closer to the season, getting ready to start their throwing program, we want to make sure that they've got some good stability at the end range in that layback position, because that's usually the area where guys complain of pain once their shoulder starts barking at them, once they start getting elbow pain. So as we go through it, we'll go through a couple of reps here. We're going to just hold the position. You can communicate with the athlete and make sure they understand where they're feeling it. Kyle's doing a good job with his core positioning. Got a good base with his lower half. Kind of working through like that. Okay. So as we go along, what we want to conclude with is understanding that the volume that we use with this is dictated by where the athlete is in season. Okay, so if it's an in-season drill, we're not necessarily going to do 3 sets of 15 and fatigue the shoulder and then go say, get in the bullpen and go ahead and throw. We might just do a quick set of 8 to activate and turn on and make sure that everything is working properly. Whereas if they're in their off season, they haven't started their throwing program, and we're looking to restore some rotator cuff strength, some anterior core function, we may do a higher volume, but that'll change. Generally, we'll do less stability work as they get closer to their throwing volume, as their throwing volume increases, and a little bit more while they're not throwing at all. So this is a good exercise that you guys can work in to fix some of the faulty patterns and increase the rotator cuff activation.